So men, what hair treatment are you using for your hair that actually works? As you approach your 30s, your 40s, you start to lose your hair. You have that typical male pattern baldness known as androgenetic alopecia, which can be hereditary. Maybe your dad had it, your grandpa had it. You might have brothers who've got it too. And you're thinking, my hair is thinning at the crowns, at the sides, your receding hairline, and you're thinking, what's going to work? I mean, the common medical treatments are minoxidil. Then you've got your tablets like finasteride and off-license treatments such as dutasteride. As we know, minoxidil comes in a solution or in a foam. You apply it to your scalp of your hair. You're supposed to massage it into the scalp of your hair, and it can take 6 months or more to see effect. In fact, some men said it has taken them 18 months to 2 years to see effect with minoxidil. And what does minoxidil do exactly? Minoxidil, stimulates the scalp, so it allows the hair follicles to grow by increasing blood flow through the blood vessels to the brain, blood vessels to the scalp area, which then allows the hair follicles to grow. But what some people experience with minoxidil is that the hair follicles that grow are quite thin, they're quite miniaturized, and this is where finasteride comes in, because finasteride is a DHT blocker, whereas minoxidil is not a DHT blocker. So minoxidil is not going to block DHT. And what is DHT? So basically, you've got the male hormone testosterone in your body. As we begin to get older, more of the testosterone is now converted to dihydrotestosterone, known as DHT. And this DHT is what causes your follicles to now miniaturize, they begin to shrink. So by blocking the DHT, this stops the follicles from shrinking and become miniaturized. And this is what the DHT blockers, such as your finasterides and your dutasterides, do. Mind you, these medications are also used in the treatment of enlarged prostate because they help to shrink the prostate through the same mechanism of blocking testosterone to DHT conversion. So what this happens is a lot of people find that combining minoxidil with finasteride is more effective than taking either minoxidil or finasteride on its own. A lot of companies are now advertising minoxidil and finasteride together as opposed to just taking minoxidil. So while you apply minoxidil onto your scalp, you take finasteride 1 milligram dose as a tablet. It's the 1 milligram dose that is licensed for hair loss, male pattern baldness in men, while the 5 milligram dose is what's used for prostate enlargement in men. Now, finasteride has side effects. It can cause headaches, depression, erectile dysfunction, reduced libido, breast enlargement, and there was concerns that it might cause high-grade prostate cancer. And check out my other video on does finasteride cause prostate cancer. So therefore, companies have come with an alternative solution, which is to take finasteride as a topical solution in combination with minoxidil. So most bottles, you have finasteride combined with minoxidil solution because it's absorbed directly into the scalp as opposed to taking a tablet for the bloodstream. Therefore, you're bypassing the metabolism, which means that you will not get the same side effects that you would have taking the tablets as opposed to finasteride solution. Instead, what you might have is scalp irritation, itchiness, redness, which is something you can deal with if you don't want to have problems of reduced libido or erectile dysfunction. Now, a lot of men have seen benefits of taking minoxidil and finasteride as a combination. They've said they've got hair growth, because the minoxidil is stimulating the blood scalp by allowing blood vessels to multiply through the increased blood flow to the area, while the finasteride is blocking the DHT. However, the question is what happens if you stop the medication? When you stop the medication, you might notice hair loss. Some men even said that they've had more rapid hair loss than they did before starting the medication, though there is no scientific basis for this. So in other words, if you don't want to lose hair, you really have to be taking these medications long-term for life. Or the alternative is going for a hair transplant. But even if you do have a hair transplant, the surgeons will tell you you still need to take minoxidil and finasteride to prevent hair loss and the hair from thinning. So there's two ways about this. You take minoxidil and finasteride, it's not working. You go for a hair transplant, you have a hair transplant, you still have to take minoxidil and finasteride, along with maybe hair supplements, shampoos, vitamin B, to thicken your hair, strengthen the hair, nourish the hair, and protect the hair. I mentioned earlier about dutasteride. Dutasteride is an off-license treatment. However, the half-life of finasteride is about 4 to 6 hours. The half-life of dutasteride is about 4 to 5 days. So dutasteride is actually more effective than finasteride when it comes to hair loss prevention. But it is off license because there is no long-term data on the safety profile and effectiveness of this medication.